The first time I got wound care, nervous, scared, didn't know what the outcome was going to be like. Tried to avoid it as much as possible, the feelings anyway. But then after I got wound care and had experienced helpful, loving souls take care of me, it put me at ease.
Wound care is a part of someone's recovery journey because it's often the way that they actually come into care. I've engaged with a lot of patients initially because they have chronic wounds or just wounds in general. And then because I've built rapport with them discussing their health, then I'm able to move on and discuss their recovery desires. And so I think it's a really important part of getting someone into care.
I want to make a decision with the person and take into account how they think it will work for them. What I will do is to make sure that I'm going out of my way to express respect for the person's experience and self. I will solicit information from them about what has worked well or not well for their dressing, for their wound, for their body, for their care. It's important to have additional incentives outside of just traditionally clinical wound care elements because people have lives that are larger than their wounds. So when we provide things like personal care supplies for people, what we're actually doing often is preventing new wounds or preventing the spread, the enlargement of whatever existing wounds they have. The same would go for a snack that is both nutritious and tasty, is something that makes people comfortable, probably stabilizes some basic needs so that we can have a better encounter anyway, and is something that clinically I know is going to do good things for their wounds, but also their health more holistically.
Empathy goes a long, long, long way, and that it's not forgotten. And you remember the people that have cared for you the most throughout their journey. I mean, that's been my experience anyway. That the people who have provided comfort, they stick out to me. They resonate with me.